Questions that deal with the anatomy of the cardiovascular system. As always, within our practice question videos, I ask that you pause the video after we initially review the question and answer options. That way you can independently select whichever answer you believe is accurate, and then I'd like you to restart the video. That way we can go over the rationale together. All right, so this is a drag and drop style question that you're going to see on the Next Generation NCLEX. This is going to test your knowledge of physiological integrity in regards to the blood flow throughout the heart. So the nurse is educating a nursing student on the passageway and flow of blood throughout the heart. Oxygenated and deoxygenated blood enters the heart through the superior and inferior vena cava and passes through to the right atrium. The nurse discusses that the blood then passes through the blank to enter the right ventricle. The nurse also informs the student that the blank is responsible for pumping blood through the entire body. So this is strictly anatomy and knowing that process and that flow of blood through the heart. So you see your answer options there. See if you can select which options belong to the blanks. All right, so this goes back to just knowing the flow of the blood throughout the heart. So when the blood enters the heart through the superior and inferior vena cava, it's going to come into the right atrium, and then it's going to pass through the tricuspid valve to enter the right ventricle. So remember, you always try before you buy. So that blood is going to pass through the tricuspid valve before it passes through the bicuspid valve on the other side of the heart. Also, the left ventricle is the largest, most muscular chamber within the heart. So it is going to receive the oxygenated blood from the lungs, and the left ventricle is going to be responsible for pumping the blood out through to the entire body. All right, this is a classic multiple choice style question. This is going to test your knowledge of physiological integrity. The nurse is providing education to the patient regarding the electrical conduction of the heart. The nurse explains that which of the following structures within the heart acts as the heart's intrinsic pacemaker, regulating the heartbeat at a rate of 60 to 100 beats per minute. So is it the AV node, the bundle of His, the SA node, Purkinje fibers, or the right bundle branch? All right, so the correct answer option is the SA node. So always remember that the SA node is the natural pacemaker of the heart. It initiates each heartbeat and it generates those electrical impulses at 60 to 100 beats per minute. The AV node receives electrical impulses from the SA node. Now, if the SA node fails, the AV node can sustain a heart rate of 40 to 60 beats per minute. Also, the Purkinje fibers, which are located at the bottom of the ventricles, the Purkinje fibers can also sustain a heart rate of 20 to 40 beats per minute if the SA and AV nodes fail. But just know that the natural pacemaker of the heart is that SA node, and that maintains our regular heart rate of 60 to 100 beats per minute. All right, this is a matrix multiple choice style question. This is going to test your knowledge of physiological integrity. The nurse is teaching a nursing student about the cardiovascular system and differences in heart sounds. For each statement, click or specify with an X whether the statement indicates understanding or no understanding of the teaching provided. So this is strictly assessing your knowledge on the heart sounds S1 through S4. So I want you to go through those statements and determine if those statements are accurate or indicate an understanding, or if those statements are inaccurate and indicate a lack of understanding. All right, so S1 is loudest at the base of the heart. This is a false statement. S1 is loudest at the apex of the heart, and S2 is loudest at the base of the heart. Now, the second one, S2, is indicative of the semilunar valves closing. That is an accurate statement and demonstrates understanding. And then remember that S1 is indicative of the AV valves closing. S3 is always an abnormal finding. That is false. So an S3 may be normal in patients younger than 30. In patients older than 30, an S3 can indicate heart failure or even ventricular regurgitation. An S4 is often indicative of cardiac hypertrophy, and it is always an abnormal finding. These are true statements. An S4 is always abnormal. It can indicate cardiac hypertrophy or even damage to the ventricular wall. All right, this is a multiple response or a select all that apply. This question is going to test your knowledge of physiological integrity. The nurse is providing teaching to a nursing student on the topic of blood pressure control in regards to the autonomic nervous system. When discussing the sympathetic and parasympathetic nervous systems, the student demonstrates a need for further teaching after stating which of the following. Select all that apply. So before we move on to the answer options, we know that we are looking for statements that demonstrate a need for further teaching. So we are looking for false or inaccurate statements. Which statements are wrong? So the sympathetic nervous system is activated when there is an increase in blood pressure. The parasympathetic nervous system involves the release of norepinephrine. The parasympathetic nervous system results in decreased heart rate and conductivity. The sympathetic nervous system results in increased heart rate and conductivity. And the parasympathetic nervous system involves the release of acetylcholine. So as you can see, this is assessing your knowledge of the autonomic nervous system and the differences between the sympathetic and parasympathetic nervous systems. All right, so remember, the sympathetic nervous system is activated when there is a decrease in blood pressure is detected. The sympathetic nervous system is then going to release norepinephrine, which is going to increase the heart rate and increase conduction speed. Whereas with the parasympathetic nervous system is activated when an increase in blood pressure is detected. The parasympathetic nervous system is going to trigger the release of acetylcholine, which is going to cause a decrease in heart rate and a decrease in conductivity. Okay, this is a classic multiple choice, and this is going to test your knowledge of physiological integrity. A nurse is caring for a patient who has a history of hypertension and is taking medication to control their blood pressure. The nurse knows that which of the following hormones is involved in regulating blood pressure and can also affect the release of ADH or antidiuretic hormone. So which of the following hormones, helps to regulate blood pressure and then it can also cause the release of ADH? All right, so angiotensin II is a hormone that is involved in regulating blood pressure. It does this by constricting blood vessels and increasing the release of aldosterone, which therefore promotes sodium and water retention. So angiotensin II can also stimulate the release of ADH, which helps to promote water retention and helps to maintain blood pressure. So medications such as ACE inhibitors or ARBs, they work by blocking the production or the effects of angiotensin II, thereby helping to lower the blood pressure. These medications can also affect the release of ADH, which can lead to side effects such as hyponatremia or hyperkalemia. Therefore, you should always monitor for signs or symptoms of electrolyte imbalances if patients are on ACEs or ARBs.